Okay, we are looking at the stomach. First, let's look at the basic parts of the stomach. The four parts are the cardia, the fundus, the body, and the pyloric region. And there are two curvatures, the lesser curvature and the greater curvature. And then we have the interior gastric folds. And when we think of the interior gastric folds, we should think of the rugae. So these are the basic parts of the stomach. Okay, now let's think about the layers of muscle in the stomach. There are three layers. There is the outer longitudinal layer, the inner circular layer, and the innermost oblique layer. And now let's think about the peritoneum, which covers the stomach. So the peritoneum covers the stomach except where the blood vessels run over it, and over a small area posterior to the cardiac orifice. So a double layer of peritoneum extends between the stomach and the liver and duodenum and liver, which is called the lesser omentum. And then there are also two layers of lesser omentum which wrap around the stomach and leave the greater curvature, which is known as the greater omentum. Okay, I want to point out just a few structures here. Well, this is the greater curvature of the stomach, and we have the spleen here, and up here we have the diaphragm, and below this is the right lobe of the liver. And right here is the portal triad and the caudate lobe of the liver. And if you remember what the portal triad is, it is the portal vein, the hepatic artery, and the common bile duct. So finally, in this slide, I just want you to look at this slide and think about the stomach bed. The stomach bed is where the stomach rests when a person is in the supine position, and is formed by the structures forming the posterior wall of the omental bursa. And from superior to inferior, the stomach bed is formed by the left dome of the diaphragm, spleen, left kidney, and suprarenal gland, splenic artery, pancreas, transverse mesocolon, and colon. Okay, as I was just saying, the stomach bed rests in a special position, and from superior to inferior we can see the stomach bed is formed by the left dome of the diaphragm. We can see the left dome of the diaphragm is up here. This is the left triangular ligament, and also the spleen and the left kidney and the suprarenal gland, and then we also, of course, the pancreas and the transverse mesocolon and the colon itself. So you can see where the stomach bed is sitting, what is underneath it. So now we can visualize the organs, and we will next talk a little bit about the blood supply.